Hello, guys. Think everyone now is ready to apply for the match season. I hope everything is okay with everyone. My name is Ahmed El Hawari. I am a third year resident now at Icahn School of Medicine at Mount Sinai in Queens. In this talk, I'll talk briefly in about 1 hour about how to achieve a successful match season. After that, I'm going to receive all the questions that you have, guys. Um, in general, before applying to the match, everyone here should have scores of the USMLE, should have the OET exam done, and should have the certificate of the SFMG. Also, everyone should have at least 3 or 4 letter of recommendations. Everyone should write his ERA CV and personal statement, and at least everyone should do 1 or 2 US clinical experience. And sometimes some people, if you guys can do research here in the United States. And more importantly is the connections, become now, or the match process become very tough and everyone needs some connections to get in. I'm gonna start by the end. I'm gonna start by the connections because everyone here how to make connections. Is it hard to make connections? And how can I reach to people? Because people is hard to reach. And even if you reach someone and he don't know you, so how can I recommend someone I don't know? So how can you prove that you are a good person and people can help you easily? So first thing, you can reach to people through LinkedIn, through Twitter, through Facebook, WhatsApp, Reddit, YouTube, whatever. This person is a resident in this program, so you can reach to him. But by this way, you're gonna create something. I'm personally call it fake connections because if you reach someone you don't know, like on LinkedIn, hello, my name is this, and I am interested to join the residency program that you are in. Can you help me or recommend me to your program? So that is fake. No one would help you like this. No one would help some people he don't know. But the real connection you can create through working with those people. So instead of coming to the person saying, hey, I want a recommendation, I want a this or that, and you don't know them, you can ask him like, can I collaborate with you in one of your research that is going on? So you can, in about 2, 3 months, you can prove that you are good, you can prove that you can do your work in a timely manner. So in this point, anyone should recommend you. This is like a simple way to get real connection, to get in the program because let's say he is writing a manuscript to study, for example, and you help it in a little part or something. You can write it in about 2, 3 days. And this way, I think anyone you finish this work for him, he should recommend you and he should write a good email to the program director because there is one thing most of the match applicants they don't know, or because still you are not still in the match now, or didn't become a resident, because the program director asking us like how many hours did you work with this person, or how many days, or how many months. We have to answer him. Sometimes they ask us this type of questions. So to reach to this point that you find someone to connect with you and to recommend you, you have to work with them. You can work with them personally, you can work remotely while you are in your home country, ask them to collaborate in research or do something to them. So by this way, the connection, you can get help from others. Also, real connections coming from helping other people. If I find you like helping others by information, by guiding them through the exams, because most of you guys like done with step one, done with step two. If I find you like give some tutoring sessions or giving teaching to others, for sure I can say like this person is very good. He is helping others, so I can help him. Also, if you want to reach to someone to create a connection, I think you should reach to some people that not a lot of people know them. Easily, they can recommend you because they don't have a lot of people in their mind to recommend. So easily they can recommend you. While if you went to someone he know like about 100 to 100 person around him, so most likely you will not get anything from him because he has already a lot of people to recommend. But my opinion, try to go to Twitter, LinkedIn, find someone he doing research already. You can collaborate with them for about 1 month or 2 months. After that, you can ask for a recommendation. I know the time now, like, it is August 17, about like 1 month to apply for the match. But I mean, like, this may help others, like, the people that gonna apply not this season, maybe in next season, so they can make this in their mind and they can reach early to the resident in the programs and they can collaborate with them in some research studies so they can get a great help from them. The other thing also, like I spoke about the connections now. So the other thing is the United States clinical experience. So it is very important now before to apply to the match, you have this. So you can get it through connections, and I spoke about connections before, and you can get this through your friends that done already with USC clinical experience. You can get this through the attending physicians that allow you to come to their private practice. Sometimes, like, it will be very hard, especially for the graduate, to go to big hospitals to do some clinical experience. So they go to private practice and they can do hand-on clinical experience, which is very good. Also, you can do that. Also, if you are a medical student, you can go to some institutions that offer, like, clinical experience, like Mayo Clinic, like a lot of places do that through applications. You have to fill the application, and it is a process some of the medical students do to get that. So once you get there, you have to write everything during your clinical rotation, because everything you are writing, you're gonna need during writing your ERA CV. Because your clinical experience or your rotation, it will be like, a work experience already, or it will be a observer experience. So you have to write this in your ERA CV. Also, you should ask for the letter of recommendation as soon as you finish your clinical rotation, because the doctor that you are doing with him the clinical rotation, usually he may forget about you. So after you finish directly, you can ask him, may you write to me a letter of recommendation, so he know you, he was still working with you, so easily he can write everything that you did with him. And the best time you can do a clinical rotation before the match season by about like 3, 4 months, because during that time, first thing, you can get a very good letter of recommendation. When letter of recommendation comes before the match, that means like, more stronger than if you get this letter from about 3, 4 years. People change. I know, like, you were good 4 years ago, but now who can say that you are still good like this? So getting the letter 3, 4 months before the match season, that is a good point. The other thing also, the program that you are doing rotation and still remembers you, so easily they can send you an invitation for interview. But if you did the rotation there about like 4 years ago, so most likely, first things, the program director changed, maybe the staff or the attending changed, maybe they forget you, so no one will send you invitation. But if you did the rotation, like, 3, 4 months before the match season, so that will be better. The other thing also regarding the letter of recommendations. So there's a very common question, like, what is the meaning of getting a strong letter of recommendation? And answering this question, it depends on more than one factor. First thing, the name of the professor. Like, if he's popular name, he has big research, he has a good position in medicine or working in a big institution, the name of the professor matter a lot. The other thing also, the content of the letter, like if it is personalized letter or generalized letter. Personalized letter, like he tells stories about you. The other thing also, the letter of recommendation, how long it is. Like some people write a letter about 6 lines, but others can write 2 pages for you, which matters also. The other thing also, if the writer of the letter of recommendation is a program director in a training program, being the writer a program director matters a lot, because that means this doctor is, like, in a training program, he knows a lot of people, and when he evaluate you and say you are good, that means you are very good. And he is a program director, so if a program director say you are good, so other program directors, okay, we can invite him for invitation for interview. The other thing also, if you do the clinical rotation in patient setting, so that is better than doing it in private practice. And if you get the letter of recommendation from this setting, it will be better. The last thing, always try to do the clinical rotation in IMG friendly program. So if you did the clinical rotation like here in New York programs, easily you can get invitation. While if you did the rotation in a big institution like Mayo, like Harvard, like Yale, whatever, like the institution, so it will be very hard to get invitation from them because these programs always like you look at AMGs more than IMGs. Try to get a rotation in the East Coast. Most of IMGs match there. The other thing also I'm going to talk about is the research. So, why you should do research before applying for the match? It is a very common question because some people saying, okay, research not important to apply for internal medicine, which is maybe right, but now currently because the process become very competitive and you should be here during the match season, especially if you need visa sponsorship. So research is very important to get connections. Research is very important to get letter of recommendation from professors that has big names and they do research here in the United States. Also, being here in the United States during the match season will increase your chances to get ranked higher during the rank order list. For example, if you are a program director and you have like 200 applicant you did interview with, and I know this applicant present here in Minnesota, but the other applicant is still present back in Egypt or in India, in other country. So who guarantees that this guy, when he comes to US, he don't have like visa issues? So for this reason, they prefer people that present physically here in United States. So being here during the match season physically, very important. Also, doing clinical rotations in big institution will allow you, like, to use their big institution email. Like you use their email during the match season to send a letter of interest, which is very important also. Because if you are sending emails or letter of interest through Gmail, no one gonna reply to you. But I mean, like if you use big institution email, sometimes you get good replies. So that is why I'm saying research is important, not about getting publication, but about other things, as I said, like getting connections, getting letters, being here present physically in United States, all of this matter. How can you get this? So through sending emails, friends, and LinkedIn, you can having publication in your CV will help you also to get a position. So having publications, it will help you like try to do a publication while you are in your home country. So it will help you a lot. And what is the best time to get research? So the best time to get research position, it will be in March after the match results. And so people leave to do their residency. So during that time, it will be very good to get a research position. And what do you need from your BI? What do you need from your BI? So from your BI, you are doing research. So first thing you have to ask for publications before the match. At least ask him like to do a case report with him or anything because very important when you apply, you have something present in your ERAS, even one publication. The other thing also, you can ask your BI to do a clinical rotation with him and try to be close to him so you can get a good letter of recommendation and you can go and ask him, I want to know more about the disease. So, he can allow you to shadow him. It is very important to do a rotation with your BI. The third thing also, try to choose BI that is MD, not PhD. So they allow you to do a clinical rotation. So if like the BI is a PhD, ask him to refer you to any other doctors that you can, like he has a lot of friends, so you can do a clinical rotation with other doctors, but try to get a medical or clinical rotation during doing your research. Also, clinical research is better than basic science research for the match purposes. especially if you have patient contact. But basic science research, most of people like doing basic science, they can get payment faster, while clinical research important because you are seeing patients and having patient contact during research, good for the match. The other thing also, like if you are on paid position after 6 months, you can ask about getting payment. That is important also because no one live here in the United States without getting payment. It is hard, I know, but I mean, like after 6 months, you can ask for that, and you can get good clinical, good experience from the previous position to find another paid position if you are if your BI not will not give you a payment after some period of time. Okay, so after like 1 year or something, you can search for another position, and you need your BI during the match season to advocate about you. He can send another emails to the programs that give you interviews, so they can rank you higher. And after getting the residency, you can keep in touch with your previous BI. You can get a remote access from the previous institution you are working in. So you can go to a fellowship. So if you are applying in the future for a fellowship, so this will be good. And you can ask your BI to review your CV. You can ask your BI to review your personal statement and before applying to the match, and this will help a lot because those professors already know a lot about reviewing CVs and personal statements, and they can help you in this. So all of these things you can ask your BI to do it for you. Now I'm gonna talk about the personal statement. So for the personal statement, what should it include? What should you write in the personal statement? First thing you have to include in this, why you choose to go to medicine. Like why, someone have a disease in your family, or you find a guy or a child in the street have a disease. Why you want to be a doctor? So that is very important to include in your personal statement. The other thing also, if you have a volunteer work during medical school, you should include that. Also, you should include why you choose to apply for internal medicine. Some people say because medicine has, complexity. You can see multi organs. You can treat the heart, the kidney, the lung, everything. So that is important for medicine. It is like a puzzle also. Some people like that. Also, you can include your work experience in your home country if you have it. If you worked for about 4 or 5 years in your home country and now applying for the match, very important to include that in your personal statement. Also, you can include why you are gonna come to United States. Like why you choose to come to United States, why not England, why not other places? Some people say we have family in United States. Some people say because it is the best training here in the United States. Some people saying because I find myself more interested to do USMLE. USMLE has a big knowledge or they give you the best training. All of this stuff you can include in your personal statement. You can talk about your research if you are doing research here in the United States. So it will be very good, and try to make your BI to review this, especially this part to you, because he know better about his research. Also, you can talk about your future goals, if you're gonna apply for fellowship or not, if you're gonna do some tutoring or not, if you're gonna be a hospitalist or not. Not recommended to write that you are gonna return to home country, but for me, most likely, if you're gonna go for being a hospitalist, just write, I'm trying to get training to be a hospitalist, or you can say just I'm trying to write to get a training. After that, I'm gonna maybe a good further training through a fellowship or something. So you can include that if you want, depending on also on the program, programs that have fellowships, so you can do that, right, I'm gonna get fellowship in the future, but programs that don't have fellowships or something, so just you can end it by being a hospitalist. Also, in your personal statement, you should tell what you're gonna bring to the program and why they should choose you, because any program now receiving about 5,000 or 7,000 applicants. So you have to be specified why this program, why not the others. Yeah, it will be what you're gonna give the program. You're gonna give them you are a hard worker, I know, but That is like, that is a very generalized word to write. Try to find specific reason regarding yourself, what you're going to bring to them. And you can read the personal statement, like, to people who already matched. Like, you can review like some personal statements before, like about 20 or 30 applicants that already matched last year. Just read everything. And after that, you can see which one is more similar to you, and you can take some words from it. Don't copy paste, yeah, for sure, but I mean, like, you can take an ideas from the other personal statements that already people that matched. So anyone matched, you can ask about his personal statement if he's not using it anymore, and he can give you some ideas what he wrote, and after that you can write your personal statement. Don't take a lot of time in writing it. Just about 2 3 days, you can finish it. So ask also someone has experience to review it for you. Usually you can go to native English speakers here in the United States to review it for you. Don't go to someone has English, like, is a second language. Like me, it is my second language, and most of you guys maybe English is second language. So we don't have a big experience how they speak. They speak maybe better than us. So try to find a native speaker so they can review it for you. The other thing also, if you are working in research, your BI can help you in or can look at it. Some resident are native English speaker, so they can review it for you. This will help. The idea here, if you are gonna ask someone to review it for you, ask someone that have experience in reviewing the personal statements. Not anyone can review it for you. Regarding the ERAS CV, so try to start writing ERAS CV as early as possible, and try to remember everything you did in your life, and even if you got small awards, you should include that. And I said before, during the clinical rotations, you should write everything you do. So now it is the time to write it as a work experience, and try to be honest while writing your ERA CV. So if your professor allow you to do observership, so you write I was observing. If allow you to do hands-on, so you can write hands-on, depending on what your professor will write to you in the letter. Because if you find in the letter of recommendations that he wrote you were observing in his clinic, and now in the ERAS you say I'm doing hands-on, so that appear like, you may be a liar, or maybe the professor is a liar, but usually they trust the professor. Also, during also the time, like, if you are doing observership for about, like, 1 month, don't write it like I did for months in your ERA CV. That is also not good, because in the letter he may write also he was coming and he was doing rotation with me for 1 month. So this will make you appear not in a good shape. So try to read well the timelines of your rotation. Like, if you are in July, you was doing rotation in Chicago. Okay, so don't write also at the same time I was doing research in Texas. That means, like, you are a liar or something. You are not writing it by the correct way. So try to look after you finish all your ERA CV, look at the timeline. Try not to make overlap. Even if there is overlap, you have to explain it. For example, if you are doing research in Texas and you are doing rotation in Chicago at the same time, you can say, like, I was having like a remote access from this institution, and by this way, I was doing both together at the same time. But my preference, don't do overlap. If you are doing rotations, so you are doing rotations this time, so this time you shouldn't be present in research. The other thing also, try to give a look on the CVs of the matched applicant before writing yours. So you can get an idea, but don't copy paste for sure. Just get an idea what they are writing, and try to make it similar. The other thing also, if you have work experience in your home country, you should write your responsibilities in detail. Don't miss anything, because work experience in home country matters a lot, especially uh, especially if you have like 5 years or 6 years, and some programs even like value this a lot. Some programs like people that have work experience in their home country. Also, don't make any gap in your CV. Like don't say like for 5 years I was just studying for USMLE. That is not good. So try to find something you did during this time rather than studying for the USMLE, like working as a primary care physician, doing working in a clinic, whatever, like doing research in some institutions. So you have to find something you did during that time. And don't write you was working any job far from medicine during that time. Like, some people here coming to United States, they have a green card, they have work permits, so they can work an Uber or whatever. So these things will not help if you are writing this in your CV. So try only to include the jobs that you are doing in medicine, not far from medicine. The other thing also, having strong social media matters a lot. Like if you have like a tutoring, if you are giving lectures, you have to include this in your CV. And also during the COVID-19, like everyone here in the world have a rule, like it was a pandemic, and I mean, like if you are working in your home country during that time, you can include something regarding COVID-19. Also, you have to write your research that you are doing in United States in detail, and you can ask your BI to review this part for you. He knows better than you in this section. So, if you are doing research for the liver, for the stomach, whatever, like colon cancer, anything, so try to ask your BI to review this for you, your research job in details. And try to write the role and responsibilities during internship year in details, especially if you are a fresh grad and you don't have work experience in your home country. So the only thing is that you did is your internship. So try to write it in details, and try not to overlap things. Like if you are here, as I said before, if you are in New York during that time, don't write I was in Minnesota also during the same time. That means like, you are there's something wrong while writing your CV. And try to put all your publication in your CV, even if it is a case report. Matters a lot. Now in ERAS, when I was looking, there is a portion for peer-reviewed journals that have already published it in paper, and there is online publication. Try to make sure that this journal, it is like published, not just online publication. Like if you are have a paper in Curious, so it is online journal. It is not like they not do it in paper. So so you can put your publications that you did in Curious, you can put it in online publication, not in peer review, not in the first option that present on us. And don't miss the hobbies, because you are a human and everyone has some hobbies. So you should talk about it. And even in the interviews, like during the match interviews, usually they start talking with you regarding the hobbies. They start everything from the hobbies thing. But if you are mentioning a hobby, you should know everything about it. Like, if you are doing a thing, I'm doing fishing in my weekend, or doing hiking. So, second question, they will ask you during the interviews, like, where did you do hiking? Where did you do fishing? And what kind of fish are you catching? Whatever, like, try to know a lot of things about the things that you are doing, and be honest in that. Even if you are not doing this hobby, at least you should know about it. And always review your CV multiple times before submissions. I said before, ask native English speakers to review it for you. Ask your BI to review it to you. You can use Grammarly or anything to correct your grammars while you are writing it. All of this matters a lot. And don't ask someone has no experience, because this will harm you. Now I'm going to talk about the program reach out. So usually before the match season, you should send a letter of interest to all the programs that you're going to apply for. After that, in October, you may send another wave of letter of interest, and maybe in late in November, you can send the last wave of letter of interest to the programs that you are interested in. So what should it include? Like, what should I write in the letter of interest? First thing, you have to write, who are you? Second thing, you have to write, what is your current position? Like, where are you working now? And you can write in a brief your credentials, meaning like your scores, number of publications, how many months you did US clinical experience, and if you have home country work experience. So just in brief, and you have to write what you're gonna bring to the program. And this portion, I'd like to make it specific, personalize it to the program, like, program present in this state. So, this state has one, two, three, four. So you can write like, I'm interested to come to this state to live there because it has whatever present famous in this state. You can write like, because people say like, program has the best didactics, program has the best research. Okay, okay, any program maybe have this, but now you have to be specific regarding the program. So in this part, you have to open the program website and find exactly what makes you like the program. Maybe they have like, point of care ultrasound rotation. Maybe they have something present in the ICU, not present in other places, whatever. Like, you can read about it, and you can read about it from the program website, and you find something special for the program. Also, you have to determine where you will apply. Like, apply for only, like if you are IMG, apply for IMG friendly programs. So you have to open the program website. You have to look at the shape of the resident. Like, this resident coming from where? This is coming from India. This is coming from Saudi Arabia. This is coming from Egypt. This is coming from Jordan. So they are all IMGs. So maybe they will accept me if you are IMG. But if you are AMG, okay, so this one came from Yale. This one came from Mayo. This one came from whatever. So you can apply for this kind of programs. Also, if you need visa or not, that's important, because if you need visa, you only will apply to programs that will give you J1 or H1B visa. While if you are a citizen, so or green card holder, so you can apply for both of them, like programs that give visa and the programs that don't give visa, but your focus will be for your USIMG programs. That will be like, you have higher chances to match there in programs that don't give visa, and also they accept IMGs. Also try when you open the website of the program to read how to apply to the program. So there is a section in every program how to apply and what is the requirement. Sometimes they do year of graduation cutoff, and they do sometimes score cutoff. Try to read it clearly. So if the program, like they have cut off at 3 years of year of graduation, so you shouldn't apply for this program if you are like 5 or 6 years year of graduation. The thing also regarding the scores. So if something not clarified, so you just can send the email to the program coordinator asking them like, I am graduated 5 years ago and you guys are writing 3 years. So is it strict or just you're gonna be flexible for that? So you can get an idea from the program itself. And you should look at the residents there. If you know someone, you may ask for recommendations if he can do it for you. So that's what I said before. Like, it may help, but not always, because you should work closely with those people before asking for a recommendation. But if you know, if you because the process is hard, and if you ask someone, it will not harm you. Just ask, and if he gonna help you, it's fine. That is good. So try, like, from June, July, August, all of this time, to reach out to all the residents that you know, and you can ask them to recommend you in this program. And as I said before, reaching out to people that are not famous will help better than people that already known, so they don't have anyone in their mind, and easily they can recommend you. Other thing also regarding the signals. So in a program, I think now it is 15 signal for the internal medicine. My opinion, try only to signal the programs that you have connections in. And this will help a lot, because let's say I'm gonna recommend you in this program, okay? And you already signaled my program. So in this point, easily you can match there. While if you are signaling like, only the big universities and your credentials not matching with this big university, so you are just wasting your signals in a programs that they will not look at you. So don't waste your signals on a programs that never look at you, and like the programs that only like taking images. So it doesn't make any sense. So my opinion, you should dream. Yes, you can dream, but dream only by about two, three signals. Don't waste all the 15 signals in a program that they will not look at you. Let's say this program, you're like first before like you do signal, just look at your credentials. You get to 15 scores. You have US clinical experience. You have 50 or 60 publications, a lot of publications. So at this point, my opinion, okay, you can signal some big programs because you have very good credentials. But let's say your score is low, you don't have good publications, you didn't do US clinical experience. So try also to signal programs that will match with your credentials. The last thing also the geographical preferences. So my opinion, I'm not recommending doing geographical preferences because doing geographical preferences will decrease your choices, especially if you don't have a family here. But if you are connected only to an area, it's fine. You can do geographical preferences and you can apply to this area. But let's say if you want to do that, so try to do like New York, Connecticut, Florida area, Washington area, all of this area easily. Like there's a lot of IMG friendly programs, but the area of California and this the West Coast, they don't get a lot of IMGs. So if you're gonna do, so do it for the East Coast. While my opinion, don't do any geographical preferences. Just you can write, I prefer to be in a good program, and I don't have any preferences because your family already in back home, so you don't have anything make you like like to be here or there. After that, I'm gonna talk about the interview preparation, but not now. Just maybe a next session, I'm gonna do it, and we can talk in detail about the interview preparation, and we can ask all the questions that you're gonna get during the interview. So now I'm gonna start getting all of your question, guys, and yeah, I'd be happy to receive it. So if anyone wanna talk, so just do unmute yourself, and yeah, you can start.
I had
Hello,
a question. Oh, I'm sorry, somebody else.
Yes.
Am I audible?
Yeah, yeah, you can talk.
Okay, so my question was, so when we send the letter of interest, who do we send it to? Do we send it to the program director or the program coordinator? Because FIDA has both the emails given.
So my opinion, you have to send it to the program director. Okay, send it to the program director, and just in CC you can put the program coordinator, but the email itself directed to the program director. Just do CC to the coordinator.
Okay, thank you.
You're welcome.
hello, Dr. Ahmed. Thank you so
Yes.
much for the Zoom meeting. Actually, I have two questions. The first one was, I got accepted at a neurology master's program in the UK. It's an online program. I was wondering how will that increase my chances, or it doesn't have anything like to do with my application or residency, since it's a master's program? That's the first question.
So let's take this question first. So first thing, did you get like do all your assembly and everything, or you didn't do the exam yet?
To be honest, I'm doing right now step two. I did step one. I do have US clinical experience and a lot of volunteer work in my in the field I'm applying to, which is in neurology.
Okay. And is this position for how many years?
It's only 1 year.
Okay, you can do this 1 year because you need some time until you finish your CK. So do your CK, get this research done in 1 year, and after that you can come after that like apply for another research here in the United States during you applying for the match season.
No, it's not a research. It's a master's program.
It's a master. Master it is part of research. I mean, like you get
Oh yeah, okay.
yeah, okay, that's my thinking. So finish this in 1 year, and after that you can come to the United States because let's say you're gonna apply for the match. You will not apply for this season. You will apply for the next season, right? So you will be done with your masters, and after that you can come to United States for the residency.
My second question is that actually I have some friends who applied last year with an incomplete application. They had the same issue. Our issue is that we get our internship here done by August during like this time, so we don't have a lot of time to get step 2 CK done on time. So we're almost always late, to be honest. But I was thinking, what do you think of applying with an incomplete application to see like give it a shot?
So if you are IMG,
Yeah.
I'm not recommending applying with applications that not complete because you if your application if you don't have the certificate for the SFMG, you will not get interviews. Even if you get one or something, it will be done. Like you can get it through connections, which is good. But at the end of the day, before the rank order, you need the certificate. So if you have a strong connections that he or she gonna make you in this program, so you can apply with incomplete application. But if you don't have connections, I'm not recommending that. That's just a waste of money.
Okay. Thank you so much.
Yeah.
Hi, Doctor. Can I ask my questions?
Yeah.
Uh, Thank you very much for the session, giving us some of your time, to address our issues. I'm Mohammed, and I'm currently a research fellow in the United States. I have a couple of questions to ask. My first question is, I started research early during my medical school, and by that time, I wasn't really hooked on like one specialty in mind, so I just wanted to participate in as many projects as I could, just to get the gist of it. So I'm applying for internal medicine, but I have a lot of like basics papers, and I have also like in neurology as well. And those are where most of my citations are. So I was a bit hesitant as to if I should include those papers in my CV, or I should just omit them. So what do you think of that?
You're applying for medicine, right? And you did all of your research in neurology. That is
No,
your
not
question.
I have in internal medicine, but since I started, I started doing neurology, so I have a lot of neurology papers as well, and those were all like most of my citations are from.
All right, that's fine. But everything matters because you know what? Before applying for the match, you don't know exactly what specialty you're gonna go in, right? Some people I know they did some research and surgery, and they did about 2 years of surgery research, and they applied already for surgery before, and they couldn't get a surgery position. They changed their mind. They applied for medicine, and they got medicine, right? So you have to put this. It is a research. Doing research is that you like the idea of doing research, not about just, let me tell you example regarding myself. My first publication, it was like, it was gynecology. It wasn't even like, medicine at all. But just that was the opportunity that I had at the time.
Mm.
Okay.
Yeah,
So they will ask you, like, why you are applying for medicine and your research or most of your research or whatever, like you have publications in neurology. Tell them because at the time I had only this opportunity and I want to do research. Okay, so that is fine. I mean, like no one will judge you if you are doing research in other specialty before. But the problem happens not regarding the research. It happens regarding the specialty itself. Some people like, do 10 years of in home country in surgery and they come here to apply for medicine. This question is valid now to them. Why you change your specialty? That is a big thing. But doing research is fun.
makes sense. Thank you. Thank you for answering my question. I'm having another question in mind. I'm sorry if I'm being too long. Um, uh, during the interview, there's always that question that it seems so simple in the beginning, but I always find trouble answering it, which is tell me a little bit about yourself. I always find myself resort back to my era CV and talking about my experience and the things I've done, and I know that this is wrong, but I just I don't know how to address this question, even though it might sound simple. So what are the advices that you have to like answer such question? Like, what is the right way to answer that question?
It means the questions that he ask you, tell us about yourself or something like that.
Yeah, exactly.
So first thing, my opinion, if I ask you like tell you about yourself, you have to tell me about fact about yourself first. Like, who are you? I'm not talking about like, I am the person that graduated from medical school at this year. I did research. I did this. All of this you can mention, but like for me, like I was telling, like, I am someone that can learn from experience. Okay. So that is good. Like, that is a brief answer. Who I am. I am someone that learn from other experiences. I read other experiences. After that, I can get an idea. And after that, I can avoid their mistakes. So that is me. After that, I can say, okay, after that, I graduated from medical school in 2017. I did research here in Mayo Clinic. I did after that this and that. So you can do, like, mention all of this. But first, you have to create a simple word regarding yourself, like about 6 or 7 words, because um, you have to grab the attention of the person that talking to you. And this was usually it is the first question people ask you. So try to sit with yourself and ask yourself who I am. Just if you can even take a quote from some people else and tell maybe that is me, and you can tell this. After that, you can talk about your achievement in life.
Perfect. Thank you. Thank you for
Yeah.
answering the questions.
Hello, Dr. Ahmed.
Hello.
I want to ask you a question. I'm Mohammed. I'm an intern doctor in Alexandria University in Egypt.
Yes.
Currently, I'm still in the beginning of my journey of my USMLE. I'm still preparing for my step one. I wanted to ask about the United States clinical experience. I will probably not be able to do electives before my graduation because of money issues and stuff like that. So I wanted to ask about post-graduation clinical experience, like observerships and other things like that. Are they of good value, or
Yeah.
should I just try to match without them?
No, it is a good value for sure. I did the same. I started to do USMLE after I graduated. Okay, so I didn't have any USC clinical experience while I was medical student. I came here, I did research, and during my research time, I was going to do rotations, which matters.
So even if I can't do electives as a student, still doing the clinical experience after graduation is good, right?
Yes, it is good. Yes.
Okay, thank you very much.
Hello, Dr. Ahmed.
Yes.
Thank you for this meeting. I have a question about also about US clinical experience. If I have the opportunity to do a hands-on US clinical experience, but at a private clinic, versus an observership, but at a hospital, at an inpatient setting, which one should I choose? I'm still an intern, so I'm considered a student. So I'm eligible for hands-on clinical experience.
Okay. So if you want to now compare an institution, hospital, and but it will be only observer and hands-on,
Yes.
but it will be in a private clinic. I agree with you. I
Yes.
understand the question. So the question here you have to ask which professor here and which professor here. And according to the names of the professors, because this will write to you a letter and this other one will write to you a letter. So which letter matters? All right. Which name is big? Which, my opinion, do it in a hospital. Do it in a hospital, not in a private clinic, because doing the rotation in a hospital, easily you can get interview even in the future from them, especially if they have a training program.
Okay, even if it is an observership, but the other
Even if
one
it
is
is,
hands-on.
yeah, even if it is an observership.
Okay, the other question, if I do the hands-on one in the private clinic and I'm still a student, could this be considered an elective, or is it called an externship, or the names don't matter?
Elective, elective, it is the same as the externship. Like you have hands-on experience. That is matters a lot.
Okay, thank you so much.
No.
Hi, I had a question about the letter of recommendations. I wanted to ask if I have an option to attach 2 or 3 letter of recommendations from the same institute where I did my observerships. It's an IMG friendly program. Should I attach some from the same institute, or should I try to pick one from there and then from another state I did an observership at? Does this matter? And
Yes, yes.
another question. Okay,
So
sorry.
before the other question, for this question, try not to make all the letters from one institute. Like I did the research at Mayo, okay? For I got two letters from there, and I because I did clinical rotation, I did research, and also at the same time I can get other letters even from Mayo, but I prefer to get others from other places, like in New York, like in Chicago, in Minnesota. You know, this mix will help a lot because this that means like all people say you are good, but if you get like three or four letters from only one hospital, that is not that good, especially if you have other opportunity to get letters from other institutions.
Yes, but depending on the quality of letters, the content,
Yes.
if I'm confident that I'm gonna get good letters from one institute as compared to other,
Yeah.
does that make a difference, or is it just preference of different locations?
No, no, no. For sure, you have to look like who gonna write this letter for you, and are you sure that he gonna write a good letter for you or not? Personalized letter, I mean.
And is it preferred to give a letter from a big university hospital, but the content of the letter, you're not sure that if it is going to be very personalized to you or not, as compared to at not a big university hospital, but still a very good, well-written letter? Which one would you recommend?
The one hospital that not university, does he have a residency program?
Yes,
Okay,
IMG friendly.
okay. Take this letter and put it.
Okay, thank
Because
you.
most likely, if you get letter from there and you put this and you apply this letter for the same hospital, you maybe you can match there.
But if I have to choose for other hospitals,
You
which
can,
one should I
yeah,
attach?
yeah. So the thing is regarding the other hospital, for me, like I'm applying now for fellowship. Okay, for the New York programs, I bought the letters that I got from New York. Okay, and for other
Mhm.
states, I bought letters that I get from other states because professors that here working in New York most likely they don't know each other from the other states. So try to look at it like
Mhm.
carefully when you direct the letter. So you got letter from New York and you got letter from Pennsylvania, for example, okay? And you did rotation in New York and you did rotation in Pennsylvania. So if you're applying in programs in Pennsylvania, try to put the letters that you got from there. And if you're applying in New York, you can put the letter in New York and something like that.
All right, thank you. I
Yeah.
appreciate your help.
Expanding on the same question, Dr. Ahmed, I wanted to ask, some programs they mention that you have to apply with internal medicine structured evaluation letter from your home country medical school. So I am an IMG, so would you suggest me to use my home country letter as a fourth letter, or should I still use a US attending letter? Which will be better for my application?
So let me ask you a question. When you graduated and how many years you stayed in your home country?
So I graduated in 2022 and then I came to United States for my research position in 24. So I'm within that 3 year, exactly on that 3 year range.
So you stayed in your home country for about 2 years, right? Or
About a year, 1 year.
about a year.
Yeah.
Okay. And if you have four letters from America, done. You don't need anything from your home country.
Okay. But some programs, they mention that as a criteria that you have to submit. So I'm wondering.
If program specifically see that, okay. For me, I was having my MSCPE. Okay, so I used it as a letter. You
Yes.
can use it sometimes, like you can use it as a letter. But when I was applying, even if some programs was saying like, we need a letter from your home country, I didn't apply by my home country letters because first thing they don't know what is ERAS. They don't know how to put even a letter. So it will be hard.
Yeah, I understand you. Thank you so much, Doctor.
Hello, Dr. Ahmad.
Yes.
Nice to meet you.
Yes, thank you so much.
So I am done with my step one and step two and OET also. But currently ECFMJ work like the website is transition to in health. So I am unable to apply for ECFMJ certification. So will that be okay if I apply for the ERAS application? Because I think I will not get the ECFMG certification before the deadline.
Okay. So when you graduated, what is your year of graduation?
My year of graduation is 2022.
22. Okay.
Yes.
So my opinion, give it a try, apply. Even if you get it a little bit later, like in October or something, apply. You may not get a match this year. I'm sorry for that, but I mean at least get the experience. Apply for about 50 programs. Don't apply widely everything. Apply to the programs that you have connections in. But at least get the experience. If you are not even getting in, but at least know everything about the application. Do your best. In my opinion, if I were you, I'll apply.
Yeah, okay. Because I don't want to waste another year. That's why I'm thinking whether to wait or to apply.
No, no, try to apply, but I mean, don't apply to about 200 program because maybe it is a waste of money. But at least you can apply to about 50, 60 programs that you have connections in that they can accept you. So, yeah, I mean, it will be a good trial. But try to also, to make a plan B. If you didn't match, so you have a plan. Like apply for a research position if you are doing research. Try to be here in United States. Do something else.
Yeah, okay. Thank you so much.
Yeah.
Assalamu alaikum.
Alaikum salam.
Thank you for having this session. I have a quick question. How do you think the best approach to go by the signaling? I know now we have 3 golds and the
And
remaining
12.
are silver. Do you recommend if for example, let's say I have a connection in a hospital, should I wait? Should I also use one of the signals like the gold, for example, if I know I would fit in that hospital, or should, for example, I for other people, some people would say don't waste it in a program that you have connection with, that you're gonna be sure that you will get an interview, and use it in another program. What do you think about that?
Oh, right. You wanna guarantee the match. Don't do that. Let's say I have connection in 5 hospital, okay? So I'll put my signals in other 5 hospitals so I can get 10 hospitals. You will get nothing. You will lose the other things because let's say you have connections. The connection will advocate about you. So I'll advocate about you and you don't advocate about yourself. That is not right. If you like the program, put a signal to them. And if you have a connection in this program, put a signal to them. So this will increase the chances to get matched in this program. At the end of the day, you want to get matched.
So would you recommend using a gold or a silver in a program that I know?
Depend on the connection itself. If a strong connection with this guy and you know that he gonna advocate about you and the program director will send you invitation. If you feel that, okay, send them gold.
Mm-hmm. Yeah, that was my approach. But I was I heard other perspectives, and I was like, okay, that doesn't make sense. If I'm interested in a program, I should give them, and I know someone there will vouch for me. I should
I
give
mean,
them a
no, 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 because if you are greedy, if you want everything, you may end by nothing.
Yeah, I agree. Thank you.
I had 2 more questions.
All right.
So the first was that if somebody does 2-week rotations in 1 month, two-week rotations in 1 month, and they put that in their ERAS CV, it would overlap, but they are both done at different times, but during the same month. So how does one put that?
Um, you can mention it during the explanation of the rotation. I worked here from about July 1st until July 15. I worked there from July 16 till July 30. So there's an option to explain this in the explanation of the rotation itself.
Okay, so
So you can
that
write it.
okay. And my second question was that just like somebody just mentioned, that the pathways this year they haven't opened till now, it's almost end of August. So do you think that a lot of candidates will not get ECFMG certified till deadline, or do you think if it opens end of August by September 24th, they should get certified?
I think they should get certified. They will not do that unless they will make all people certified by that time.
Yeah, because it's not our fault. It's
I know.
ECFMG. Yeah.
I see that. I see that. Even I was asking one of my friends regarding IRAS and busways. He told me we don't have it till now. In my year, I got like the busway in June, I believe. So it was very early. This year it is different.
One more question regarding step three. So, since a lot of people came to the US here right now to give step three and do clinical rotations, like myself, but I'm unable to give step three because of the pathways. So, if somebody comes back in December and gives their step three, how can they report their score to the programs and that they have passed the exam?
So in general, you can send them an email telling them like, you got step three and you had the score for it. That is the first thing. But try from now to be prepared for the exam, like, study, do everything, do your work. So at the time that you have the certificate and you can do step three, just do it. And you can update the programs through emails.
Okay, thank you so much.
Yeah.
But and this is like follow up to this question is more of an immigration related question. Uh, if somebody comes to the US once for like a few months, let's say 4 months, and then they come back again, let's say I'm leaving in September and I come back again in December, would that cause problems with like J1 visa in case somebody matches?
No, you are talking about B1. You have B1, right?
Yeah, I have B1, B2.
So when you match, you will apply for another visa with CG1. This is totally different. But my opinion, as I said, during the interview season, which is between like November till January, during these 3 months, November, December, and January, I think better to be here in the United States.
Okay. I mean, we
But
can try.
yeah, because during the interviews, they're gonna ask you, where are you now? So if you said like you are here in the United States, that make me us like make the people that doing interviews you feel better because that means okay, this person don't have any visa issues, this person present here in the United States physically. So if they rank you higher, that is good because they know that you easily can start your job in July 1st.
Yeah, that makes sense. Thank you.
So I mean, like you can arrange your travel to be after January, after finishing all of your interviews, and you can be here from October 1st.
Yeah, let me try that.
Yeah.
Hi,
Uh,
Dr. Ahmed.
Yes.
I have a question, please. I will just start my ENT residency in a hospital, in a university hospital in Egypt.
Where you start
And
residency?
in a university hospital in Egypt.
Okay.
You just mentioned that there will be a weak point in the CV if I change my specialty. Should I quit the specialty or what should I do?
Can you like speak more clear so I can understand you?
Uh, should I quit the specialty, change my specialty? You have just mentioned that it will be a big weak point in the CV.
Yes. So you are
If
doing
I
what
choose
specialty in Egypt?
ENT,
ENT, and you're applying for medicine, right?
of course, I'm then in the beginning of the practice.
I mean, like, but you're gonna apply for medicine. Is it correct?
Yes.
Okay, okay. So my opinion, if you have the ability to change ENT to medicine, so you're gonna do medicine in Egypt and medicine in the United States, which is be better. I know some people like matched in like they did ENT before in home country and after that matched here in medicine. But usually they ask a question like why you changed your specialty from ENT to medicine, and it will be like some programs even they don't even send the interview just because you have no zero commitment to medicine. Okay. So if you have the ability to do medicine in your home country, so do medicine in Egypt and do medicine here in the United States. Doesn't matter if you're gonna travel to United States. So why you choose ENT? Like It is hard specialty, surgery, other stuff. So why you do in your life two residencies? That's too much.
Yes. You said that for the university. So, okay.
Yeah, I mean, like,
Thank you.
I know there's university, but I mean, like, you have good chances also to get medicine in other places. Not, I know, not maybe not the university, but you can get it other places.
Yes. Thank you.
Yeah.
Uh, Dr. Ahmed, thank you for having this session. I have a question that I'm currently doing a research in institutions, and I will get a letter from the chair of that department, but he is a neurologist. So as I am applying for internal medicine, will it be an issue?
So you are doing research in neurology, and you will get letter from neurology, and you're applying for medicine. Are you applying for neurology or not?
No, actually, my department is neuro-oncology department, and my PI is from internal medicine. He is an hemato-oncologist, and my PI told me that he will bring a letter of recommendation for me from the chair of neuro-oncology department, but the chair of neuro-oncology department is from neurology background. So
Okay, so let's say something. Did you work closely with someone, with the ones that it is in neurology department or not?
yeah, sure. I'm closely working, and I have collaborated on a research paper with the chair of neuro-oncology department, and he knows me very well.
Okay. Other question. Do you have other letter of recommendations? Like if you have, my opinion, if you have four letters of recommendation from medicine, so don't apply by the one from neurology. Okay. Like if you have already
No,
uh, four letters of medicine, that's fine. But if you don't have, and that is the only one like you have, okay, you can put it in your ERAS.
okay, thank you.
You're welcome.
Dr. Hawari, I have another question. So I'm currently doing like a master's in public health now here in the U.S. To graduate next year, and I was considering, instead of having like a clinical one of my four letters of recommendation, that I use a letter from my program from the director of my program in the master's program, and also my mentor in the program, to use it as one of the, instead of using like one clinical or academic, I would use because my mentor has a PhD. He's also like a professor, and he's the director of the master's program. So I was considering getting a letter from him and using it as the fourth letter, rather than using like a letter from an MD. What do you think about that?
So it depends, like how many months you worked with this with the PhD one?
So far, it will be 3 months by the match, because it's accelerated master's public health. So we finished our summer semester. We're starting our fall semester, but by the time of the match, it would be like maybe 3.5 months.
And the MD one, how many months you worked with him, or you didn't work
With
with
who?
him?
The MD?
MD, yeah, MD one.
Like would be a month, because he's in. So I can choose, because I have 5, but I can choose between one I did observership with and one I did externship with. Both of them would be like a month and 2 months. So I was considering, since I'm gonna add that I'm currently a student of Masters of Public Health, it makes sense that I use a letter from my from the
Yes.
program director of the program for my masters.
So that is good. So what I'm saying is apply like is the ones that you are doing masters. I can say it is a research. He will write you good research one. Okay.
Yeah,
So
it would be
apply by
academic.
this. Yeah, academic one. So you can apply by this one, and the remaining it will be clinical rotations, which is fine.
Yeah. So I was also planning, because I have a publication with one of the professors, another professor, I worked with him for just solely for research. I didn't work with him clinical. So I was thinking I use one for my master's, one for the publication, which I worked on for 2 years, and 2 clinical. So it would be like diverse collection of letters.
Yeah, that is good. That is good. So even for me, when I applied by one from research and 3 from rotations I did in United States.
Okay, thank you. So Another
Perfect.
question: how do you recommend if I did my step 3 before, let's say before submitting the ranking? How do you suggest that we go about? Like, do I send emails to all? Like,
If
let's
it
say
is
if I
before,
took my step 3
if it is
by
before, I believe there is an option that you're gonna add your step 3 score in the ERAS.
right?
Yes. I didn't do that. I did step 3 after I matched already. But from as far as I know, before applying, if you have a step 3, there's an option to be done. You put in ERAS.
And all the programs that I apply to would be notified, or
Yes, because you remember when you are doing the RAS, there is USMLE scores transcript. So step 3 will be added on them.
Okay, thank you, appreciate it.
Yeah. Any other questions?
I had a question. So, I do have like a research position offer, but it's in neurology, and I want to apply to internal medicine. So, is it recommended to take this position?
I know this question. So if you don't have any other options, just come to United States with this position. I know you're applying for medicine, and the only option for you now to come to America is to do research in neurology. So come do research in neurology and apply for medicine, and you will not get a letters from it. Like just when you start the process to come here, you're gonna be like in maybe in November or December. So you already will be inside the match. Just you will use this position to be here present physically in United States.
Yes, that's what I was thinking. And like in case like things don't work out, will it
If
help?
in case it doesn't work out, you can change the position after that to medicine.
But then I did cold email like thousands of doctors, and this is the only one that responded.
I mean, like
So,
when you are present here physically, like you can start your neurology position. After that, if you didn't like the work there or something, I mean, like you can change. You can ask other professors in medicine to do research with them. So it will be changing. The G1 will be the same, but you will change the position itself.
okay.
Like when I started in nephrology. After 2, 3 months, I changed nephrology to GI because I like GI more. But while I was in Egypt, I didn't get any GI. So what should I do? Should I stay? No. I can go to nephrology, and after that, I change it to GI.
Okay. Yeah, makes sense.
Hello, Dr. Ahmed.
Hello, yes.
Thank you for your effort of this video. It will be recorded.
Yeah, it will be recorded, yes.
So my question is, what do you think about the new changes of my Intel? Do you have any idea?
The new, again, please, the question?
The new website, my Intel.
No, I don't have any idea about the new website, actually. I'm not following all of this new things. I'm just telling from my experience that I had before, so I don't have.
I get your
No.
point. Thank you.
Dr. Howard, I have a question.
Yes.
So let's say I understand that community hospitals. I'm not sure if how much community hospital highlight the research, like when it comes during their residency. Like from your experience, since you're applying now for fellowship, what are your recommendations? Like this is beyond the match. What is the recommendation? Like inshallah, if we match, what should someone do who like wants to apply for a comparative specialty, if he matches or he or she match into a community hospital? For me, for example, I'm interested in GI. I'm gonna inshallah start working soon with a GI professor. So, but during residency, what do you recommend which someone should do during residency if they want to apply for a comparative fellowship? Because I know the workload in community hospital, especially like if New York City is very overload to even finish the notes every single day and do and rotate all the patients, attend the rounds and everything. What do you recommend? What did you do during your residency in order to be competitive?
So yeah, to get a competitive fellowship like cardiology, GI, hematology, so you have to do research during your residency. Some community programs they don't even offer you the opportunity to do research, which is tough to get in. So you have to do research. I know the workload is high, but you're gonna finish at least around 7 p.m. or 5 p.m. depending if you are long call or short call. So let's say you are long call in this day. So my opinion during your BGY1, try to divide your days to two things. First thing, in your BGY1, you need to study. You need to get some medical knowledge because next year you're going to be a senior on a team and you have to take a decisions for the patient. And the patient safety will come first. You have to have some medical knowledge. Don't waste all of your first year in doing research and you'll be very weak in medicine. This will be like a bad choice for you. So what I was doing is let's say I have 7 days in the week. One day it will be off. I don't do anything. I'll have vacation. I'll go whatever I want. So I have 6 days. 3 days of them, I was just opening Mix app, studying, doing a Word, whatever I was doing. And the 3 other days, I was focusing to do GI research, to get some opportunities, to write a case report, whatever I have. So you have to do both. I know it is hard for you to find everything, but I mean, you should try. Second thing, if you are working in community hospital, the problems that you're gonna face is you don't have a mentor because most of community hospitals, the attending there, they don't care a lot about research. They don't do a lot of research. So you can reach to some other professors in other institutions and start to collaborate with them, start to build connections through research. So you can write or share in writing manuscript, doing meta-analysis review, or you can do some cohort studies depending on the access you will get during that time. Sometimes they give you even EPIC access to the institution, so you can collaborate in some clinical trials or EPIC or some cohort studies, which is good. So what I'm saying is, during your BGY1 year, you have to divide the days. Into days you're gonna study medicine, and other days you're gonna do research. While you start your BGY2, you now become a senior on a team. Your medical knowledge is good. So and the fellowship application will start in the beginning of the third year. So during this year, second year, you will have more time to do more research. So you can focus at this time on research more, and you can do some other publications. So you will have very good profile while you're applying for the fellowship.
I see. Yeah, thank you. Thank you for covering the mentorship because that would be my next question because I know community hospitals
Yes.
struggle with the mentorship.
I mean, I have a friend that was working at Mayo. They get remote access from there, and they start still now, working with their professor. So I mean, I'm here in Mount Sinai. I have access from Mount Sinai main, so I'm doing research with them. So that's how it works.
Okay, thank you. Appreciate it.
Yeah.
Hello, Dr. Ahmed. I think you can hear me.
Yeah, I hear you. Yes.
Thank you very much for your this session. I would like to thank you because you put your time, your effort. You give us a lot of information. I'm chief from Ethiopia, so I wanna to apply in internal medicine. But I have future subspecialty goals, so I'm so interested to apply in cardiology. But I have a lot of different research from nephrology, GI, hemato-oncology. So if they ask me what's your future goals, and they see my research, that's the different types of internal medicine. Does it affecting my match process or my opportunity to match in internal medicine?
No, it will not affect you at all because, as I said, research it is only one point. They look about other things. They look about the letters. They look about the home country experience if you have. They look about the US clinical experience. They look about your USMLE scores. Research is only one point, and even you are now applying for a clinical job. You are not applying for a research job, so no one will judge you on that.
Okay, thank
Yeah.
you. Thank you very much. I appreciate you.
Yeah. Anyone else have any other questions? Um,
How long do you think the personal statement should be? Because in the ERAS application, the word limit is a lot. It's more than 1 page. But what's the ideal length?
I mean the processing to be present in your application, or
No, the personal statement. So the space that ERAS provides to write the personal statement, it has character limit, and that is more than 1 page. So
yes,
how
yes,
long do
yes.
you recommend it to be?
So usually I'm doing my personal statement about 1 page and about like 6 or 7 lines. 2 pages, but not all the 2 pages for sure. I'm saying 1 page and about like 7 lines or something. Depend on like for me, I'm doing about 7 paragraphs. One first paragraph I was doing why I chose medicine. After that, I was writing about my tutoring, my volunteer work. After that, I was writing about why I choose medicine, internal medicine, I mean. After that, I'm writing why I choose to come to United States. That is another paragraph. And another paragraph I was writing about my research. And the sixth paragraph I was writing what gonna I bring to the program. So 6 paragraphs. So 5 paragraphs present in the first page, and the last one was in the second page.
Okay. And there's a section in the ERAS called impactful experience.
Yes.
So if somebody puts, like, if somebody has like a very personal, impactful experience and they put that there, should they not put that in the personal statement or they can mention it in both places?
You mean like something personal to put in impactful experience?
Yeah, like somebody had some significant hardship and they put that in impactful experience that because that's what they ask, right? That if you had some
Yes.
hardship or something significant happened to you,
Yeah,
should we put that in the
that
personal statement?
that is a good question actually, and I wanna highlight something regarding this. While you are writing your impactful experience, try to avoid the money related issues. Because a lot of applicants, like, even me, I was like facing financial problem during while I was applying. Okay. Don't say like, while I was applying, didn't have money. It was hard for me to apply. I came from different country, whatever. That is hardship we all facing. In IMG, face this problem. But what I was writing in this section, I can say like, changing the culture, changing the healthcare system, it was challenging for me. Yes, it's challenging to everyone here, but try to avoid like talking about if the problem was money related, make it more social related. That will be better even if someone writing it, reading it. Yes, for sure, you missed your family. For sure, you are living here without your friends, right? So that is a challenge. But money-related issues, okay. So everyone here, like, you can get some money from other one, and after you match, you can return it back, which is fine. But I'm telling you, just if you are writing impactful experience or challenge, personal challenge, you can write like, you left your family behind, you came here to achieve your dream, so that was challenging for you. You changed it, like, let's say you worked for 5, 6 years in your home country, and you came here so you want to change the healthcare system, which is also challenging for anyone here. You changed your culture. You have culture here. You come here to different people you are dealing with. You change in even your language, right? So all of this is challenging to us.
But wouldn't that be something that every IMG faces? Wouldn't like if an IMG doctor is reading that CV and they see this, like you've written this, they'll be like, they are so weak, like they get that's the basic experience that every person goes through, and they
No,
think that's challenging.
no, not all IMGs have the same problem because some of IMGs already have their family here. They call the USIMGs, okay? So it is different for us. For us, I think we are very different. Like, we are leaving everything behind and come here. So it is more harder than anyone else.
So if we mentioned this in our impactful experience, do you recommend like writing a few lines about it in our personal statement as well, or there we don't mention anything about this?
In personal statement, you can mention that actually. I mentioned this in my fellowship personal statement, but not in my residency personal statement, because in my residency personal statement, I just only was here for about 1 year or something, or about 8 months. So it wasn't logic to say after 8 months I missed my family, right? But after 4 years, no, I missed my family. Okay, so I mean, it will be logic now to mention that, but in the beginning, I couldn't mention this.
Okay, yeah, makes sense. And like a lot of people have said that don't let your personal statement repeat your CV. So like we have research in our CV and we have like these US clinical experiences. So do we give actual patient examples in our personal statement or we reduce that? Because when I have written my first draft, I was talking about, because I have home country work experience. So I was talking about like patient cases, but I got feedback that don't write too much about cases.
Yes,
So
that's what
what
I'm
should we
saying
write
always.
instead of
That's what
that?
I'm saying. Like while writing personal statement, don't mention details about patients, because I want to read your personal statement to know who you are, not who you are treating, because we all have patients in our life. We all have a lot of research. Okay. I can write, I'm doing liver, I'm doing this, I'm doing that. Yeah, it's fine. But just only one paragraph regarding my research, and only I'm highlighting what I'm doing, what I am doing, not what publication I did. I'm not mentioning even names of publication or something. Just I can say I'm doing research in the liver. Okay. Done. What responsibilities I can write manuscripts, I can do this and that. If you are while I was working at Mayo, I was having patient contact, so I was getting to get questionnaires from patients or something else. Okay, so this part maybe I already wrote it for me, but the remaining thing, like you did US clinical experience, you can just talk in general. What is the differences you find here and you didn't find back home? What you like regarding US healthcare system, right? So don't say I met with a patient with hypertension. This stuff you can write, or the professor can write it for you in your letter of recommendation, but not here.
Okay, yeah, it makes sense. And I mean, it's personal for everyone, but how did you tackle the question of why internal medicine? Because most of the time, the answer that I get is that I like solving puzzles related to the human body, and that is a very, very like uh, cliche answer. Everybody gives that. So how do we like make this a more personalized answer for this?
That is a good question also, because what I did. Now I can be different because I read a lot of personal statements, so I can get some ideas what people write. All right. So to avoid copying paste this thing, because medicine is a puzzle, medicine dealing with all the organ systems, so you can get exposed to all the diseases present in the world. People write that. Okay. Some people like to write other things, like you will say, I was playing chess and I like to use my mind, so I like medicine more. Some people say, because my father has this disease and this disease affected him, so this disease is medical illness, so I like to treat people like that. So I mean, everyone has different opinion, but at the end of the day, you're gonna end up by the same thing. You don't want to use your hand, you just want to use your brain. It is medicine. Because if it's a surgery, we will talk about their hand skills more.
Yeah, but we do use our hands in medicine too, like
I mean, yeah, simple procedures. I mean, but not like surgery. Surgery, most of the
yeah.
time they are using their hands.
Dr. Wadi,
Yes.
So I have a question regarding the application. I heard somewhere that we can call programs during the match cycle. So ask them like some people said, if you waited like 2 months and didn't get like interviews or didn't get the number of interviews that you were hoping to get, maybe in December start calling programs, asking them for interview, asking them to review your application. What do you think about that? Because I know that some programs, as far as I know, send interviews in phases. Like sometime they send interviews in October, and then the second phase November or December, last phase maybe in January. I don't know. Some interviews just review the applications once. So what do you think about this?
You mean to send more than letter of interest at multiple time period?
No, I mean like calling or sending an email to the program, not the program director, the program assistant. You know, the
At
program
what?
director.
Yeah, I understand. At which time you gonna call them?
I don't know, like which time do you recommend?
So, my opinion, um, first thing you should send the letter of interest before applying, like in August, okay? Second thing, give them 2 weeks after submission of the application to review. So, let's say from about October 10, October 15, start sending the first wave or your second wave, to be second wave now, of your letter of interest. Because most of the interviews gonna be sent at the end of October, okay? And the beginning of November. So before the end of October, you should have sent letter of interest, okay? After that, at the end of November, you can send another wave of letter of interest.
So about the letters in August, like now I'm not sure about the programs that I'm gonna apply to, but I am aware of the connection that I have in some hospitals. So you recommend like I send a wave of letters in the hospitals that I have connections in?
Yes, you should, and these letters should be personalized, and even you can take a permission from the person that's gonna recommend you, and he can, like you can mention him in the email.
Okay, yeah, that's interesting. So what do you recommend I say in the letter of interest? Like, can you give me like an
So I'll
example?
give you an example, easy. So first thing you can say, what is your name? Your name is Islam. So you can say, I am Islam. I'm graduated from this medical school. I am originally from this country. I am interested to apply to your internal medicine residency program and try to mention the name of the residency program. And after that, and I would like to introduce myself. So you can write a brief credentials like your scores, and you can write your US clinical experience and your research experience, and if you have home country work experience, all of this you should write. Um, and you can mention like if you have a connection in the program. I know doctor, and you mentioned your connection, and he spoke very highly about the program. He told me the program has very good didactics, and the program has this and that. And you can even read the page of the program and find something specific regarding the program and tell him and he told me this line program give 6 months of or 1 month of point of care ultrasound. The program gives this or whatever, you'll find something specific in the program website, and you can mention that. All right. And after that, you can ask for invitation, ask for interview. So you mentioned your credentials, you mentioned your friend that present in the program, and you mentioned what your friend told you about the program.
What if, example, hypothetically, I don't have my step 2 score, but it's by August. I'm gonna get it like in September. Do I wait until I get my step score?
To send your
Yeah.
letter of
Or should I
interest?
like
No,
ignore?
but you did the exam, right?
I'm gonna make it like in 2 weeks. I'm gonna do it in 2 weeks.
Okay, yeah, you have to wait at this point because um, sending the letter of interest without mentioning anything about your credentials to be hard.
I see. Okay, thank you.
Or you may, you can send a letter of interest, um, but don't talk about your credentials in this point. That I mean, like you have to tell them that you are here.
Yeah, that's what I was thinking of. Okay.
Yeah.
Okay, thank you.
Yeah. Anyone else has any question?
So if somebody has like a backup specialty that they're applying to, like for example, family medicine, and all their experiences in their CV are of internal medicine, should they even bother applying to family medicine or like just leave it?
Again, your question, Ishina. Again, can you repeat it?
Uh, so for example, if somebody has like a backup specialty like family medicine and
Mm.
they're applying to it also, but they don't have any clinical experience in family medicine, and they are using like an internal medicine outpatient letter, which is written by the same IM doctor, but for family medicine. Should they apply to family medicine or should they just skip the idea because they don't have really like family medicine
It
experience?
is actually family and the medicine, internal medicine is very close together. Okay. Part of our rotations in internal medicine, we are doing primary care physician. We are doing primary care like a family medicine. So they can use the letters of internal medicine to family. That's fine.
Okay. But they have to write like different personal statements for
Yeah, they have to make. But I think personal statement, it will be one, I believe. Or no, 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 it will be more than one. You can do more than personal statement and you can direct personal statement to every program.
and do you need to write like different personal statements from for programs that you're signaling?
Yes.
Like,
I'm
okay.
thinking that also, like, if you are singling 15 program, so try to make to those 15 program specific personal statements. And for the other programs, make it generalized.
Okay. And somebody mentioned to me, I rotated in a community hospital, and they mentioned to me that don't mention anything about a subspecialty in your like interview or personal statement. Focus on like be like medicine first.
It doesn't
So,
matter a lot. It doesn't matter a lot. Like, just you can write your future goal vague. Okay, I'm still thinking about it. You know, I'm thinking about getting another training, but you don't know what the other training, maybe fellowship, maybe other things. So no one knows.
okay.
Doctor, does mentioning work experience back home has any effect by any means for
Yes,
the doctor?
it is very good. Like I tell you exactly, in my program, most of people are coming from home countries, they have work experience. Okay, that is very good. Some programs value this a lot, and other programs they like fresh grade. It is different. No one has the same thing. But most of the programs, if you are working in your home country, they value it, especially if you are old graduate. Being old graduate, you have to mention what you was doing during these 6 or 7 years in your life.
Dr. Hawari, do you recommend sending the letter of interest to the program director or the assistant program director?
I said before, like send it to the program director and do CC to the coordinator.
The coordinator. Okay,
Yes.
One last question. So, since we are requesting LORs, a lot of doctors they delay sending you the letter, like even if you had worked with them and asked for it while you were rotating with them. So, how do we approach that? Like when you've sent like many reminders, but they still keep saying that they will upload it, but they don't.
Yeah, people are busy, but the problem is, you know what? You have to mention to them that it will take about 7 days to be processing. If they upload to you now, it will take some time until it come on us, right? And that is the problem. So, but you can do something. For sure, this professor writing a lot of letters to people before you. So ask them, reach out to them, like between you and them only, like, when he uploaded to use the letter. If he upload at the end of the day, he upload on time, that's fine. Don't press him. But some professors, like, those letters in October, November, so time flies. So in this point, no, you have to press. You have to tell him, like, you're gonna need the letter because it will take about 7 days for processing, and the letter should appear on ERAS at the end of September. So I mean, like, ask about his history. If he already like doing things sometimes, that's fine. But if he delaying things and this may harm you, so try to ask him for the letter. The other thing also, you have to find another plan. Let's say he will delay the letter or something. You have to find other letter to be uploaded.
Yeah, because all the doctors, they want to know what's the latest time that they can upload the letter.
Tell them and like you should upload it in August because it will take some time in September to be processing. Just tell them vague answer like this.
Okay.
Hello, just a question regarding the personal statement.
Yes.
Do you think like it can be 2 pages instead of one? Is that okay?
I think better to be 1 page and one paragraph after that. Don't make it 2 pages, like, the whole 2 pages. That's a lot.
Yeah, but it's really hard to get it personalized and detailed within the 1 page limit.
I'm not saying 1 page, I'm saying 1 page and one paragraph or two paragraphs. Don't make it 2 pages. One have time to read 2 pages.
Yeah, so like a page and a half is okay, right?
Yeah, page and a half, page and a quarter.
Okay, thank you. But also, like how do you think we should personalize the personal statement? Like specifically in parts when talking about why we pick internal medicine or why we choose a certain program. I know like you can go on their website, but they are usually the same thing, like all the programs have focus, all the programs have some kind of resident wellness activities or some kind of research activities. It's sometimes hard to pick something that's really unique to that program.
Yeah, that is right. So you can mention they have very good didactics, they have very good mentorship, they have very good research. Besides that, you have to mention something regarding the city. The city itself, it is different from other cities for sure. Like, the cuisines of the food present in the city. For sure, it will be different than other cities. Like the things that you're gonna visit in the city, if they have museums, if they have something, city life, like let's say New York City here, it is city life. You can say like, I like to live in the city because it has one, two, three, four. So besides the didactics and the research and other stuff, you can mention something personal regarding the city, why you like to live here.
Yeah.
I want to follow up on that
And
point.
and yeah, and before you follow up, just a second. And also, like, when you write your letter of interest, you will make it personalized usually to the programs that you already did the signals to. Okay. Like the other programs, it's fine. I mean, like, you don't have to make it personalized, but the programs that you did signal to them, you must do it personalized.
Okay, thank you.
Yeah.
So regarding follow up on that point, let's say, for example, I have a connection in a hospital, let's say in Arizona, that is
Okay.
not in my geographical interest.
Yes.
And I signaled that hospital, but it was not in my geographical preference. How do you recommend I approach that? Like, is it
You
by
shouldn't do geographical preference. That is the
what?
first one. You shouldn't do geographical preference. You
I
should
shouldn't
not.
do? I
Yes.
shouldn't?
Yeah. Just make it like, you're gonna go to any place that can offer you good education, good training, and good mentorship.
Mm-hmm.
You can write it in the line why, because he ask you why you don't have any geographical preferences. You can see that. Unless you have a family. Do you have a family here in the United States?
No.
Okay, so you don't have geographical preference. You can go anywhere, right?
Yeah.
So don't make geographical preferences. Why you are limiting your choices? Does it make sense?
Mm-hmm.
Especially you are like doing signal to a program that not in your geographical preferences. So they will, because it happens to me. I did geographical preferences while I was applying to residency. Okay. And after that, I said to myself, why I did that? It was actually it wasn't correct at the time because one of the programs that they was considering me, like for interview. I sent them letter of interest in the beginning of October, asking for interview. They told me like you didn't choose our area as a geographical preference, and we saw that you changed your mind. I told them like, yes, I'm living here. I was living in Minnesota at the time, and the program was present in Minnesota. So I'm living here, and I'd like to continue here. So they sent me after that the interview, but they didn't like me. They didn't like what I did. Like I did all my preferences in the East Coast. So why you are looking to get interview from the Midwest? And the program just try to find a reason to exclude you. So after that, my mind it changed to not to make any preference, just to make it I can go anywhere.
Oh, so you can change your geographical preference during the match?
No, you cannot.
Oh.
So if you did it, make it from now. I didn't change this time.
So what do you recommend about the urban, suburban, rural?
Also, I don't have any preference. Like I said in the comment in this is time, I worked in Egypt in rural and I worked in urban, and I find myself I can work in both.
I see. So what if, example, let's say like I want to apply for all the programs that I am currently in the states that I'm currently residing in, and I want to show them that this is my preference. This is where I am living in now. Do you show that in a letter of interest, or because
Yeah,
I
you
would
can write
rather
that in
stay
the
in the
letter.
same state.
Yeah, in the letter of interest you can write that. Letter of interest is different than ERAS. I was talking about ERAS.
Mm-hmm.
Don't make in ERAS geographical preferences. But in letter of interest, usually I'm right. Like, I like to live in New York, I like to live in Maryland, I like to live in Florida, whatever.
Mm-hmm. Okay, thank you.
Any other questions, guys?
So is it okay if I have some US clinical experience, but in some other specialties than internal medicine, for example, assuming like my main specialty I'm applying for is internal medicine. So if I have a rotation in neuro or pathology, is it considered a red flag or some
You
kind of
shouldn't. You
mysterious?
shouldn't. Yeah, you shouldn't put it. If you are applying for medicine, just to put the things that you are doing in medicine, unless you are applying for two specialties at the same time. So it is
So
different.
it
But
really hurts my chances for like
yes,
doing this.
it will decrease your chances in both.
Okay.
So I mean, like if you're applying only for medicine, just to put the US clinical experience you did in medicine and letters you got from medicine.
All right. Thank you.
Unless you did the rotation, like, while you are a medical student. So at the time, you didn't have any, like, any idea what you are going to do in the future.
Yeah, this is my
Yeah,
case actually.
yeah,
Yes.
I understand. So if you have, let's say something, if you have 4 US clinical experiences and you did 4, it's fine. I mean, like, because they ask you for 10 experiences, right? So in the 10 experiences, let me talk briefly about this. So most of you guys have research experience, so it will be 1. And you have to put 1 volunteer. You have to put at least 1 tutoring if you are teaching any medical students or something. You can put about 1 work experience if you did in your home country. You can put your internship years. You can put 1 or 2 or 3 US clinical experience. Okay. So remaining other 2, you just gonna play around. Like, you can see like what you did exactly more. For me, I have 2 volunteers. I have more in research. So I did at Mayo, I did at Mount Sinai, I did here and there. So I can put more than one experience in research. So that is the thing. You are according to the person. Which thing is more important for this job? You have to ask this question to you. Applying for medicine, so why should I put experience in neurology while you have other things better you can put, like more experience in medicine? So look at the whole thing in your CV and try to pick it carefully. Which thing is better to add?
Sure, makes sense.
Thank you so much, Dr. Ahmed. It's not actually a question, it's your take, your perspective on the match. So I think most of the candidates, they almost have similar CV, similar scores, and you have been on the other side. You might also be taking interviews for your programs. What do you think makes a candidate match beyond their CV? What makes it click for the program that yes, this is the guy? If you have any perspective on that.
You mean how they choose the applicant?
Yes, yes, because most of the candidates, they're almost the same on paper, right?
All right, that's correct. That's correct. So usually there is some catchy things present in the person's CV. I can notice for me, like, if I look at someone's CV, I can look like, someone has 270 plus in scores. Okay. This is that is not normal. I have to see this guy. Okay. Someone has like, more than 20 publication. That is not usual. So most likely some programs like to have this guy at least for interview. Um, some people like, they don't require visa. Okay, that is a good thing. So some programs not friendly with visa, so they like to introduce this guy or to like. And the big thing regarding the interviews here currently happening is the connections. Like, if I have like someone close friend to me and I worked with him already closely and I did publications with him. So if I send a specialized email guarding him to the program director, and the program director already like liking me and he knows that I'm a very good person, so most likely he gonna recommend someone good also. So this will help to get an interview.
Okay, thank you so much, Dr.
You're welcome. But so I mean, like, sometimes it depends on the CV. If there's something special in the CV, like scores, like number of application or something like that, other things happens through the connections.
Okay.
Any other questions? Everything is okay? Um, I wish you guys the best in the match. I mean, like, just to prepare yourself. Reach out to people. Offer help also. It is very important. If you can help anyone else by even a little information regarding the exams, how to prepare, how to study, that will be very good for me.
Thank you so much, Dr. Ahmed, for this session. We are really, really grateful to you.
You are welcome.
I appreciate your time. Thank you.
Yeah.
You are welcome, guys. You are welcome, guys. I'm gonna end it now. And yeah, if anyone in the future have any question, I mean, like, you can reach out to me.
Thank you. God bless you.
You are welcome. You are welcome. Yeah.